But for now, I believe we have another video. Let's see here. This is going to be, it's talking about the child here. We're just going to be focusing on the adult this evening. We're going to give you a quick overview of what we're going to be doing before we head into the back here.
First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR.
And again, I just want you to kind of observe this and see how they're doing it.
Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together. Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest. Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go. Each compression should be smooth. Let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Okay? Stop.
Now with that video, anybody who's taken the class before, do you see any differences in what they're doing compared to what you've done in the past? What do you see?
Well, it used to be that you would measure 2 things.
You would. You would try and avoid like the sternal notch. You would stay in between the nipple line. You would be doing measuring. They've taken away a lot of that. For one thing, if you're talking about nipple line, that can confuse people because sometimes you can have nipples down here. And if you're not paying attention, some people will start doing compressions on the abdomen because they're strictly thinking nipple line. So what they've done is they've tried to take away a lot of the more confusing aspects of it and just tell you to go directly in the center of the chest. If you've got a hand in the center of the chest, you're going to feel a pretty hard bony spot. You're not going to want to be feeling anything squishy. So you're going to know that you're in the right spot when you're just feeling the hard part of the ribs. Another thing that they've changed on this is the way that you do your compressions to breaths. Used to be, you would always give 2 breaths first. We've always talked about airway breathing circulation. You give your 2 breaths, then you go into compressions. Now they've changed it to where they want you to give your compressions prior to giving your first sets of breaths. So you give 30 compressions upon finding that the victim is not breathing, 2 breaths, back into your 30 compressions. So that's another thing that's changed with the CPR. They want you to go in about 2 inches when you're compressing the chest. And if you're looking at chest size, you've got, like chest sizes are going to be 38 inches around, 40 inches around. When you're compressing 2 inches, that's really not going to be too much when you're thinking about the mass of a person. You're going to be going in about like that. And with our mannequins, there's a way to tell when you've gotten 2 inches deep so you can get a little bit of practice with that. So what I'd like to do now, I think I'm going to have everybody come up here instead of going into the back so we can be on the carpet. But I'm going to have everybody hop up here and pair up if we could. And since we got the 2 girls, you can work together, and then the guys can pair up. Oh, I didn't see you over there. I'm sorry. We're going to have half of you, if you could, pass out on the floor, and the other half is going to rescue. I might want to push this table back just a little bit. Can I get you to move that chair for me for a second? You come onto this side. And then if you go onto this side, you'll be pretty good. So do you remember what the 3 C's are when we're getting ready to do this? You had it there. You're checking. You're checking the scene, checking the victim, then you're going to call, then you're going to care. So first thing you're going to want to do is you're going to want to check your victim here by coming up, tap them on the shoulder, and ask them loudly if they're okay. So go ahead and approach your victims.
Are you okay?
Are you okay? You turn your head away from me. Are you okay?
So at this point, you haven't got a response. What's your next thing that you're going to do? Call 911. So everybody find somebody and have them call 911 for you.
Call 911.
Call 911.
Perfect. So now you know that you have an unconscious victim. You know the scene is safe. Help is on the way. So now you got to figure out what's going on with your victim. The way you do that is you roll them over. So kneel down next to them and we're going to start rolling. Hopefully we have enough room here. I think we've got everybody set up so we can roll correctly. Take the hand closest to you and place it up over their head. Then you're going to get a hand on their far shoulder. Nice shot. And a hand on their far hip. And you're just going to roll them on over. Roll them towards you. Again, by rolling them towards you, you're going to be able to stop them with your knees halfway so you can get your hand on the back of their head. Once you get your hand on the back of their head, you'll take them the rest of the way over. Oh. Yeah, I'll have you pass out this way a little bit more. Or I can push this desk back and then you can hop on the other side.
Your guys and my guys. What?
There you go. Now, if you hop on this side of them, you'll be able to do that a little bit easier. Yeah, I feel bad waking everybody up for this. Once you get them into this position, do you remember what you're going to do with their head? Hand on the forehead, 2 fingers under the chin, and tilt that head back a little bit. There you go. Again, that's going to open up that airway, so if they were just kind of choking on their tongue a little bit, opens up the airway so that they're able to breathe. Now you're doing at least 10 seconds with your face up to theirs, looking down the body, looking for bleeding, looking at circulation, looking to see if that chest rises and falls. So you're going to be, there you go. And if you tickle him with the things of your shirt there, then if he wakes up, you've done a good job. So after your 10 seconds there, like what we just watched with the CPR, which we'll get into a little bit more later, after 10 seconds, if you're not seeing any breathing, you would immediately go into chest compressions. At this point, we're going to say that they have just passed out. We're not entirely sure why. So we're going to want to put them into that recovery position, which is going to be the arm closest to you up, the leg closest to you in a TP position. Yeah, we got some. Can I get you to slide down this way just a hair?
It makes it so much easier when your victim just gets up and moves for you.
Yeah, she said a half hour. We're getting close to that.
Yeah.
And now you're going to put a hand on the far shoulder, hand on the far hip, and roll them towards you again.